Hi everyone, I'm Kristen Adair, and this is my journey through surgical correction for my Pectus Excavatum. It's been a while since you've seen me on video. I have been extremely busy with life in a great way. My Numbness procedure was almost 3 years ago, so coming up here in a couple weeks, November 8th, is going to be my 3-year anniversary. And I am gearing up for my removal surgery. So that's what this video is going to be about, is just updating you on my life. And I have a lot of questions I get on a regular basis, so maybe a frequently asked questions. So first off, yeah, I have been very busy ever since I had my surgery. Only 4 months after that, I met the man of my dreams, and we are actually getting married in 3 days. So I've been very busy, as you can imagine, planning a wedding, moving in together, traveling, working, just living life, and being able to do that through my surgery and being healthy and working out and just enjoying my life. So I'm very happy. I do apologize that I'm not very present on my Facebook page. Like I said, I've been really busy. I do every once in a while go on and read my messages. It's just very hard for me to message everybody back, and so I do apologize if you've sent me something and you've been waiting for my answer. I'm going to try to touch on some of the most important questions I found and most common questions, so hopefully this can help. Also, I want to say thank you, of course, for all of the support of everybody, all of the people out there that I don't know. I feel like I know everybody, and it's really nice, and I appreciate all the very nice comments that I get from everybody. And if I have helped or touched just one person, then all of this was worth it, and I'm truly blessed and truly happy, and I'm glad that God gave me this opportunity to just share my story, and if it can help somebody, then that is wonderful. So just wanted to throw that out there. My removal surgery is scheduled for November 18th, so I just want to let you know that I'm going to go ahead and film like I did for my original surgery. So I'm going to take you with me pre-op, and then of course post-op right after the surgery, so you can kind of see what it's like for me. Of course, everybody's going to have a different situation and a different outcome and a different result, so just keep that in mind, that you always want to consult with your doctor and a medical professional, because I am not a medical professional or a doctor, so I can't give exact advice, but I just want to throw that out there as well. And I wrote myself some notes, so that's what I'm looking at. I had X-rays taken. So I had X-rays taken a couple, probably about a month ago. It was maybe a month or two ago. Everything looks great. Everything is in the same position, exactly where it's supposed to be. So I had that sent over to the Mayo Clinic, my doctor's office. And in case you're not aware, my doctor is Dawn Jarzewski. We all call her Dr. J. And she's at the Mayo Clinic here in Phoenix, Arizona. And she is amazing. So that's who my doctor is, and I had the x-rays sent over to her. They looked at them, and then we went ahead and just booked the surgery. It's going to be outpatient, so that's something to look forward to, even though I will say the Mayo Clinic was amazing, and the nurses were all awesome. I remember sending thank you cards to all of them afterwards, because I actually had a good time. Isn't that weird to say at hospital? The food was really good. My bed was comfy. The nurses were nice. I didn't actually want to leave. So I don't think many people can say that. So although I am glad it is outpatient, if it was inpatient, I wouldn't have minded, I guess. I don't know. Maybe I'm crazy. Okay, so let's just go ahead and go to some questions that I get. Number one. Okay, I do get a lot of questions about my implants, because obviously I've shared that with everybody, pretty much an open book here. I had implants put in when I was 22, I believe. I'm 31, by the way. I just turned 31 yesterday, so that was a while back. And the reason I had the implants put in was because I wasn't aware of the damage that was going on inside my body yet from my Pectus Excavatum. So I just knew I had a giant hole, and I didn't like the way it looked. And so I wanted to mask that hole by getting implants. And I achieved that. It worked for a little bit until I started having all the problems that I had. But when I had my Numbness procedure done, they removed my implants, put the bars in, and then they put new implants in. So I do get people that ask me if they can have surgery without having implants. And of course, the only reason I had the implants involved was because I already had them in before the surgery. There's no reason to have implants. You don't need them. That is a personal preference. It just depends on what you want as a female. So don't pay attention to any of that if you don't have the implants in. I shared my story in the way I did about my implants because a lot of women were concerned whether or not they would be able to still have the Numbness procedure with implants in already. And the answer to that, of course, is yes. I'm a walking example. So when I have my removal surgery, there is a 50-50 chance that they might rupture the implants that I have in now when they pull the bar out. You never know. If that happens, I have chosen to have new implants put in. If it doesn't happen, then the same implants I have now will stay, and everything will be the same. So I'm crossing my fingers that they don't rupture, but you never know. So you just have to leave it up to God, and we'll see what happens. Another question was info on my doctor. So like I said, Dr. Dawn Jarzewski, Mayo Clinic, Phoenix. Go online. She has plenty of, it's called drjpectus.com. So drjpectus.com. That's her website that she's created. And there are plenty of videos that she has filmed, question and answer info. So go there and you'll get a lot of information that's helpful. Another question is, let's see, you guys want to know what my physical results were right after surgery, immediately after surgery. So if I can remember correctly, when I first woke up from surgery, of course you're on pain medications and you just had a surgery, so things are kind of all over the place, but I do remember feeling a sense of instant relief because of all that pressure on my chest for all of these years. I felt like for once I could take a giant deep breath. I've never been able to do that before. So yes, it is instant. Of course, after a while, after you're done taking your pain medications, you're done with your surgery recovery, as you move on in life, you're going to notice it more regularly. You can actually take deep breaths. You can breathe. With my lung capacity, I believe I was at about 70% before my surgery, and I'm still about 70% after my surgery. What I was told was you can do long breathing exercises. Yoga helps, because obviously in yoga class, if you've ever taken it, they practice a lot about breathing, so that helps. But with my lungs, they haven't actually grown. I haven't been able to expand them, so I do have a decreased capacity, but I have noticed I can breathe better because there's nothing actually pushing on them, which is all I care about. And then what my scars look like. So I actually posted a picture on my Facebook page. So if you go to Facebook, if you have one, I'm going to try to flash the info down here if I have time, if I can figure it out. But it's let me make sure I wrote this down. www.facebook.com/Kristen's Heart. So KristenSheart. That is my Facebook page. It's called Follow Your Heart, Kristen's Journey. And it's a public page. So go on there, and I actually posted a photo not too long ago of my scars. So it was just a couple months ago, and that's what they look like today. I never really put any cream or scar gel or anything on them yet, because I knew that when I have my removal surgery, they're going to just open up those same incisions anyways, and so I'll deal with that after. After I'm all said and done with the surgery, then I will go out to Walgreens and I'll pick up some cream and whatever I need, and I will try to work on those. But they're really not that bad, and to be honest with you, I kind of identify with them because it tells my story, and every time I look at them, I think of this incredible journey that I have taken and the strength it took, and I kind of like them. They're my scars. They're my character. So they're only about this long. And they're one. I'm not going to obviously lift my shirt up, but there's just, it's like, I want to say it's like right here. There's one right here. And obviously the same exact thing on this side. So it's really not that bad. The only time you can see them is if you're in a bathing suit. My bathing suit covers like this. So you can just see a smidge. If I have a dress that's got the back cut out, it sometimes will go like this, and you can see some of it. Oh, I also have here, I have a couple little dots, and you'll see them in the photo if you go onto my Facebook. But I had a chest tube put in, and that's what those scars are from. So they're just little dots, so it's no big deal. And honestly, I don't care what people think. I mean, that's my story in my life, and it is who I am, and I don't care. So don't worry about scars. It doesn't mean anything. Okay, questions or tips to ask the surgeon. People ask me a lot about what are the most important questions that I think they should ask when they go see a surgeon, and that is not something I can answer for you. You have got to really think about that on your own. When I went to see the surgeon, I had a pad of, I write lists, that's what I do. Okay, I'm always writing lists. I always have pads of paper everywhere. I wrote down any important questions that I might have had, so I didn't forget to ask while I was there, because you're nervous. You're going to forget. You're going to. So bring some paper and pen. Don't worry, doctors, I know they're usually in a rush, but that's not always the case. They want you to ask questions. They want to help answer your questions, because the more prepared you are, the better they're going to feel and the better the surgery is going to go. So it's a good thing to ask questions. But honestly, the reason I picked Dr. J, well, there's a lot of reasons. Obviously, she's amazing. I did a lot of research on her prior, and I was thoroughly impressed. I knew this is the person I wanted to see. Then I found out she lives right down the road, which that was a pure coincidence. I was willing to travel. When I found out she's right down the road, okay, then you add in convenience. That's very convenient, obviously. But what really did it was when I met her, the feeling I got the second she left that room was peace, excited, comfort. I had no doubt in my mind, that she was the one I wanted to open me up. I absolutely love her. She is down to earth, confident, skilled, everything I would have wanted. So you really just need to feel that way about your surgeon. You need to feel comfortable that this is the person you are choosing to perform the surgery. It's a major surgery. And make sure you ask all your important questions, like your downtime, your recovery, how many bars do you think I'll need? All of those questions. How many nights am I going to be in the hospital? Do I need somebody to take care of me? What kind of medications am I going to be on? How are you going to control my pain? Am I going to get a catheter, an epidural? What kind of pain medication are you going to give me? Oral. So it's just a lot of questions you need to think about and write down, and just trust. You need to go with your gut. You just really do. You know, people always say trust your gut. I'm a big believer of that. So go with your gut. Another question, numbness. Okay. The numbness is probably the one thing that I don't like. I was prepared for that. I was told that obviously there's a lot of nerves, and things that are going to be going on in there is that, you know, you're sliding these giant bars, and they're not little. They're not these little tiny bars. Mine are 10.5 inches long. Everybody's got a different body, but mine are 10.5 inches long. They're about, I want to say they're like that. Okay, so they're big. So you have a lot of nerves in your chest, and when you're sliding something in, you're gonna mess some stuff up. Not in a bad way, but this whole area. So once again, I'm not gonna exaggerate. It's literally this entire area in the front. Back is fine, just the front. I am numb still. They can't really predict that. Everybody's going to be different. Some people will have numbness for a little bit, then it will go away. Some people won't have any at all. Some people will always have it. And that's not something that they can help or predict. So it is what it is. What are you going to do? I would much rather be numb and healthy and protecting my heart and not putting it at danger than, you know, be sick. So I'll take the numbness any day. I've learned to kind of deal with it. They say you can kind of like massage and try to bring back the flow of things to your nerves and try to get rid of it a little bit, but that never really worked for me. So it is what it is. We'll see what happens after the next surgery, but it is some getting used to. It's really weird at first. I'm not going to say it's completely like blackout numb. Like if you touch me here, I can feel it, but it feels weird. It doesn't, it's just, I can't explain it. It's numb. It's not a tingling feeling. It's just a, you know, it doesn't bother me unless I'm actually touching that area. Then it's just a little weird. So yes, I do have numbness, and that is probably the only downside I would say for me. Working out after nuss. Okay, I'll get a lot of questions on this, and let's be honest, I'm working on my muscles, but as you can see, I don't really have any. I'm in shape, but I always have been. My favorite thing, everybody's gonna be different, but you just need to be careful. Ask your doctor when it's safe for you to start working out again. Let them know what your workouts consist of, because every workout is different. I do minimal weights. I think that's important, especially at first. You don't want to do any kind of heavy weights where you're going to injure yourself. So right after surgery, what I did was I hired when I was ready after my recovery, let's get that straight, I hired a personal trainer. I found one that was affordable, and I had him for, I want to say, maybe 3 months. But I told him about my condition and what I needed to focus on, and I just didn't want to hurt myself, and I wanted to learn how to do certain moves properly without hurting myself, and that's my main reason for having him. And he completely understood, and we worked on it, and I think that was a really good step, because it taught me, you know, the right way to have, what kind of posture was right for lifting a weight, period. So in general, you didn't hurt yourself, but also for your pectus, for the bars. So I did that for about 3 months, and then I went back to Pilates. I was doing Pilates before the surgery, which was my favorite. So I was able to do Pilates class like normal. Any Pilates class, it didn't matter. I also did a little bit of yoga. And like I said, yoga is good for your lungs, for breathing, and that's what they say to do if you're going to try to expand your lung capacity, if it works for you. And what I do now is actually my favorite thing I've ever found. I go to Bar 3. It's a bar studio here in Arizona, in Scottsdale. And it's the ballet bar. So we do a lot of things on our tiptoes, and but it's a mix. So we do cardio. We do weights, but the heaviest weights we use, arm weights, are going to be 5 pounds. So they have 1s, 2s, 3s, I think they have 4s, and then the 5s. And then we do stretching, which is important, and then stuff on the mat on the floor. So there's a lot of different things to that class, which is why I love it. But I find that I can do pretty much everything. The only thing I have issues with usually are push-ups or any kind of planking, because when you're doing that, it's going to require a lot of strength right here, which I don't have so much. So I modify. And the reason I like going to Bar 3 where I go is that they understand the concept of modifying, and they don't make you feel bad for it, or it's not intimidating and you don't feel weird. They believe that you should listen to your body, which is exactly what you should do. That's my advice. Listen to your body. You have to. You don't want to hurt yourself. You have to listen to your body with everything you do. And that is my motto when I work out. And they completely get that, and I love that they get that. So what I do is, instead of doing a plank or a push-up on the ground, I will actually go up to the ballet bar and do it up against the bar. And there are other girls in the class who don't have Pectus Excavatum that are at the bar too. They're modifying as well. So it makes you feel comfortable, like you fit in. So I modify as much as I can. If my weights are too heavy, I go down a weight or I drop them all together. So really, that's my honest opinion, is listen to your body, consult your doctor. But you should be able to do everything you want to do after having the surgery. I mean, I'm not a runner. My fiance is a runner. So he tried to see, if I would want to do that with him, and I tried. I did a 2-mile run, and then I did 2 5Ks. So I do have 3 medals to my name now that I never had before surgery. So that's an accomplishment. However, I will say one really cool thing is I can actually run now where my heart lets me, my lungs let me. It's an amazing feeling, because I've never been able to do it before. However, now I've got, okay, my lungs are involved, my heart's going, and they're all saying, yes, green light, green light, green light. But my legs are the thing that are red lights, and that has nothing to do with my surgery. So I decided it's really not for me, and now I just go and cheer him on, which is fun. So the last question I have is, was it worth it? I get that question a lot. And like I said, there are going to be, of course, with any surgery you do in life, there are going to be pros and cons. Was it worth it? 100% yes. That is a no-brainer for me. I mean, if I didn't do this surgery, who knows what my health would be like. And I did not want to take that chance. The pressure being put on my heart was actually causing my heart damage. Through testing, we found that I was starting to have a little bit of regurgitation. I have mild regurgitation in my tricuspid valve, which obviously isn't a great thing, but it's something I can live with. However, that was just the first
step. So if I would have not done the surgery and the pressure would have still been on my heart, who knows what would have happened after that? I mean, I could have had other things happen to my heart. I could just break it down. I could have heart failure. I could have other leaking and other problems. So I don't want to know, and I don't have to know. So thank goodness. Yes, I can breathe better. Like I said, my lung capacity is not 100%. I know that. But I can breathe better because I can actually take deep breaths and fill my lungs better than I used to be able to. I do still run out of breath when I talk, but I'm also nervous when I speak, so that has a little bit to do with it. I'm kind of shy and not very outgoing, so that has something to do with it. I feel better. I don't have chest pains anymore. So yes, it was worth it. It was so worth it. I am so thankful that I did it. And I would do it all over again. And the numbness that I told you I don't really care for, no big deal. I can totally look the other way. It's not a big deal. So that's that for now. I think that answered a lot of questions, hopefully. And like I said, I do apologize that I am not responding to private messages. It's just so hard to keep up with everybody, and
Like I said, I'm getting married, we're going on a honeymoon, and then I'm having my surgery. So please stay tuned though, because I will be posting more videos for my surgery. I'm going to take you with me, and I'm really excited. I cannot wait to get these bars out. I can remember at my 2-year mark when I went to see Dr. J for my 2-year follow-up, I was starting to have some aches and pains that I normally don't have, and she told me, she warned me, she said, okay, I get it, because most of my patients feel this way once they hit your 2-year mark, you're just going to be like, get these out of me. Yeah, she's right. That's how I feel. So the last year has been a little bit challenging because I can feel the bars more than I ever have before. Now, when I say that, it's different every day. Every single day is different. It's just going to depend on the way you slept. All the activities and the energy level of the day before can affect you the next day. So it just kind of depends. Every day is different. But I do have days. It'll be like, I'm going to say 1 day every 3 months, so that's not a lot, where I am in pain, where I need to take some ibuprofen and I need to ice myself or use a heating pack or just take it really easy. But that's not that much. I mean, I can deal with that. I'm pretty strong. I know a lot of people have said that too. I make it sound like it's so simple, but then they go through it and they have a hard time. So I'm sorry. I must have a higher pain tolerance than a lot of people. So in no way, shape, or form is this surgery small. Is this surgery a piece of cake? This is major. This is giant. It's important surgery. There's going to be pain. There's going to be swelling. There's going to be things that you don't like. That's just how it's going to be. You just really have to be strong and hold faith in whatever you believe in, and just be strong and go from there and have a good support system. That's really important. So, where was I going with this? There's days I have those one kind of days here and there. Yeah, she said, I'm going to want my bars out. That's where I was. So yeah, I can't wait to get them out. I am super excited for my surgery, once again, and it can't come soon enough. And I am praying that everything goes as planned. And like I said, it'll be outpatient, so I'll be in and out and back home. And I think that's it. So I will talk to you guys later, and thank you so much for watching my video. And also I wanted to mention I do have a group on Facebook. So I have a Facebook page, and then I have a group that I created, and it's kind of a discussion group where people can feel safe to ask questions and not feel stupid or embarrassed. And it's for females only. Sorry guys. But I thought it was important to make a space that was just for females, where they felt they could share things that they didn't want guys to see. Especially since we talk about implants and stuff like that. Guys don't want to talk about that anyways, but it's called, let me make sure I say this right. I'm not sure the actual website how to get to it, but it's on Facebook. It's a group, and it's called Female Pectus Excavatum. So go on there, join the group, and we have girls that share pictures, that they feel comfortable enough sharing pictures of their dent, or their before pictures, their after pictures, just to get advice and tips, and just feel like you're connected to somebody. You're not alone in this big old world. There's actually other people out there that are just like you and going through the same trials and tribulations you're going through. And you're not alone, and we're not alone, and we all love and support each other. So that's it for me. I hope you have a great day or night whenever you're listening to this, and I will see you soon. Bye.